When you have an early miscarriage, when are you able to actively start trying again? So, really, it's once your beta is negative. And when you talk about the early miscarriage, it kind of depends a little bit on what the scenario was and what you were doing. If you had done, IVF or an IUI, then we were following you very closely. If it was a spontaneous pregnancy, and you know that the pregnancy has ended, really what we want is for you to wait until, in that situation, until you have your first normal period. So in a spontaneous pregnancy, your beta will drop down. If you're following it, you'll see that happen. Beta, of course, is the pregnancy test. Then basically what happens there is that eventually you will get yourself a period. Once you have that first normal period, you are fine to resume trying. If we have done something to get you pregnant, so let's say that we've done IVF, we did an embryo transfer, and unfortunately that transfer resulted in a miscarriage. Situation there is that we're either going to treat that pregnancy loss, or we're going to follow that beta down to zero. Once it has gone away, you'll have a period there as well, and then you can resume. Now, we used to tell people that we would like for you to wait for 3 weeks, or 3 weeks. I'm sorry, that we would recommend that you wait for 3 months before you get pregnant. There is no truth to that. There is no data to support that. And someone that tells you that is kind of just basing that on, well, it sounds like a good idea. And that kind of used to be the recommendation because it was the common lore. Now we know that once you have that first normal period, you are fine to resume. If you get pregnant again before you have that first normal period, there is an increased risk for another pregnancy loss. So, for that reason, that's why we want you to be able to wait.